Hello, I'm Dr. Gustosby, owner of Oasis Dental Arts. Today, I want to discuss with you one of our newest acquisition, the KaVo OP 3D X-ray system. It is the newest in 3D technology on the market. It can scan the mouth and convert it into a 3D model. That model is very accurate. In the past, we would take many different angled X-rays that were up to 30%, had 30% margin of error, and would use them with stone models to try to piece together the patient's anatomy. Today, we can see the 3D model on the screen, and it basically takes all the guesswork out. For example, for implants, it can show all the vital structures and their exact location. Let me bring that up. So if you look at this, we can see the nerve, and we can also look at the sinuses from basically any angle we want. And there's actually many different views. I'll go over some of them. We can basically predict implant success because we can measure the quality of the bone, its thickness, and its health. And so if you look at this, we place basically an implant right there, and we can place it anywhere in this bone, and we can basically make sure that it's not hitting the adjacent tooth and it's not hitting any vital structures. Very important. So with this, we can create a surgical guide. So if you look on the right, we've taken a scan of the patient and printed a 3D model, and on the left we've created a surgical guide. That surgical guide, if you look at that silver opening, it basically, let me show this, it fits over the model, and it basically fits inside the patient's mouth. That controls the angle, the depth, and the location of the implant. So it makes it a very safe implant placement. In the past, we would freehand the implant placement, but we were placing implants not in the most optimum position. In addition, we can better see pathology. So let's go over and take a look at this. This patient came in and had pain on a tooth and inside their sinuses that they had for a while, and no one could figure out what was going on. So we took this scan, and you can see where it says infection near sinus. Patient had a failed root canal, and that failed root canal had eaten at the bone and basically was very close to piercing that membrane and piercing the sinus. Now, a 2D X-ray, regular X-ray, only picks up the most dense structure. So it cannot see defects unless that defect is all the way through the bone and tooth. So with this, we were able to see behind the tooth. In the past, when we couldn't see this, we would tell the patient to return after they could figure out exactly where the pain was coming from. And basically what that meant was patient had to wait till there was enough damage in the bone so we could see it. Or there is basically the pain had become severe enough that they knew exactly where it was coming from. With this system, it just makes it much easier to diagnose. The other thing is we can see pathology in the sinuses or in the jaw, TMJ, that traditional x-rays cannot even reach. So we can see the sinus in this picture, and you can see the sinus are actually clear. we can see the membrane, and we're not seeing any cysts inside the sinus. It would clearly show itself as a thickening of that membrane. Another benefit to this is it can help patients who are severe gaggers with traditional x-rays. All you have to do to take this x-ray is stand up and hold still while it rotates around your head. So please check out our website, oasisdentalarts.com, for more information on this unit. Thank you.